Tonight to the efforts to get the smallest among us to simply survive. Believe it or not, it is a growing problem in Texas. Newborns dying before their first birthday. The infant mortality rate in both Texas and the nation did get worse in recent years. Doctors and researchers are hard at work right now trying to find some answers on the why. Tonight, Andrea Lucia, though, learning how some who are just now getting started in their careers are looking to make a difference.
It can be overwhelming to think I have to memorize all these things, but if you kind of apply it to a person, it makes it worth it.
A third-year medical student at TCU, Lucia Lettel, is already tackling one of medicine's major mysteries. Why, in a developed country like ours, some babies don't survive to see their first birthday.
Infant mortality is a huge topic and something I'm really passionate about. And as we know, Tarrant County has one of the highest percentage rates.
A University of Texas study found the highest infant mortality rate in the state right here in the middle of Fort Worth, in zip code 76104. Nearly 2 out of every 100 babies born to women living here don't make it.
I want to have an impact no matter what stage of training I have.
At TCU's Burnett School of Medicine, several students, including Lucy and her classmate Amber Broderick, have made the survival of our area's smallest residents the focus of their thesis projects, each approaching the problem from a different angle.
We essentially wanted to look at out-of-hospital births versus in-hospital births.
So you can test a moral reflex.
Lucy and her mentor, Dr. Dave Riley, have found babies born outside of a traditional hospital setting are more likely to end up in a neonatal ICU hours or even days later.
Some of the conditions that they were suffering from, especially if you're talking about injury to the brain or infection, actually turned out to be a lot worse because of the time delay.
We did find that they had more neurological complications, respiratory complications, longer stay in the NICU, and were on antibiotics longer.
Still, despite the risks, Lucy's found there's growing interest in birthing centers and even home births.
I was looking at the Tarrant County public health record, and there is a huge spike circa COVID, but even before that, it's been an increasing trend. And I do think it comes down to that potential mistrust in the healthcare community or that autonomy that they want.
Were you surprised by the demographics?
Yeah, you would think potentially that it would be low-income people that couldn't afford to go to a hospital, but really it's middle-class people that are choosing to birth at home and those with an education.
Lucy is now visiting locations where women have suffered complications in birth to learn more about them.
You can apply almost every concept we learn to a real patient.
Ultimately, though, the goal is to find ways to cut down on any delay in care when problems do arise.
I genuinely believe that that could help lower the infant mortality rates.
That's your optimal positioning of the forceps on the baby.
I've always been very passionate about just wellness in women.
Amber, meanwhile, is researching racial disparities in maternal care.
I also grew up with a really young mom. She was a teen mom.
Coming from a multiracial family, she's keenly aware of how women of color are at an increased risk of complications.
We heard in the news, like Serena Williams is having complications from pregnancy that she shouldn't have had, or, there's a lot of times where Black women specifically have issues with their delivery experience or their pregnancy that can be prevented.
This kind of transcends like socioeconomic status too. It's really a racial difference where people feel like their voice is not heard.
With her mentor, Dr. April Blake, she's surveying new mothers to find correlations between their perception of how they were treated and their race.
We're looking at, did they think that their pain was controlled? When they asked about pain medication, did they get the answer that they needed? Did they have any complications that they weren't expecting?
Part of it is trust of the healthcare system. The other thought is that there's some degree of implicit bias that happens within healthcare providers.
A better understanding of the problem could spur solutions.
Do we need to change pain protocol? Is there some step in the delivery process that needs to change?
You want to start from head to toe, and we call that a head-to-toe physical exam.
Young as they may be, these TCU students are ready to break new ground in the fight to save the littlest lives.
You listen in all 4 quadrants.
In Fort Worth, Andrea Lucia, CBS News, Texas.